answer all of your pressing plastic surgery questions. So today we're going to keep a short topic here, and then of course we'll kick off with your questions. And like I said, you can ask me anything about plastic surgery from head to toe. You can ask me about pre-op, post-op, the procedure itself, what to do after surgery, etc. And you know that you're getting good and reliable information, right? Because it's coming from a double board certified, Ivy League educated, Duke trained plastic surgeon with over a decade of experience. Okay. All right, so get those questions ready, but in the meantime, let's talk about something that's becoming very, very popular, especially here at Pure Plastic Surgery, which is the combination of your tummy tuck with fat transfer to the hips. That's right. So this can be done at time of tummy tuck alone or at time of mommy makeover, all right? But I want you guys to be aware that it is possible and it is okay to transfer fat to the hips at the time of your tummy tuck. And not only that, not only is it possible or okay, but I actually highly, highly recommend it, okay? Because that's what's really gonna bring out those curves, right? So when we do a tummy tuck, we're gonna be, of course, removing all the excess skin, and then we're doing that muscle repair on the inside, kind of like that internal corset, and then we're doing liposuction to the flanks and the waist, again, shrinking in that waist. But if we just do that alone, it's gonna do nothing for your hip dips, right? And let me tell you, I don't know the exact number, but it must be like at least 8 out of 10 women have hip dips, okay? And so if you wanna just go ahead and fix that hip dip at the same time, we can do a little fat transfer to the area, and that'll really bring out that hourglass shape in one surgery, which is at the end of the day what we're all looking for, right? So yes, so I highly, highly recommend the fat transfer to the hips at the time of the tummy tuck. And it is okay. Why? Because typically you don't need much more than 500 cc's per side to fill in a hip dip. So as you can recall, I'm always talking about what can and cannot be combined, right? And some of the reasons for that. And so one of the things that that I don't combine is tummy tuck and BBL. So is this the same as this? No, it is not, okay? I'm not talking about doing a full BBL at the time of a tummy tuck. I'm not talking about Lipo 360 and then fat transfer to the buttock and hips. All I'm talking about is doing that liposuction to the flanks and the waist. And when I say flanks, I mean all the way to the top, from the armpit, from the axilla, all the way down to the waist area. And then using that fat to fill in the hips, specifically the hip dip area. Or if you don't have hip dips and you just want a little bit more hips, then that's okay too. But the whole point is to bring out that hourglass shape, okay? So why is it okay? Well, as many of you know, here in Florida, we do have rules. And those rules are sent to us or are set by the Florida Department of Health, okay? And so the Department of Health Board of Medicine sets rules. And one of the rules that they said is that when you do a tummy tuck, you are only allowed to remove 1,000 cc's of fat via liposuction, okay? That's it. That's all you're allowed to remove. And so if you follow the rules, and here at Pure Plastic Surgery we follow the rules, then that's all that we can remove. That's what most patients have in their flanks and the waist. Okay, so we can't do a Lipo 360, all right, because you're gonna, it's not gonna be effective. Most people, Lipo 360, you're gonna be removing 4,000 cc's, not only 1,000 cc's, right? So you're not gonna have an effective Lipo 360. And then, while 500 cc's per hip is a good amount of volume for the hip, it's typically not enough of volume for the buttock in order to make a significant change in the buttock itself, okay? So I do not combine tummy tuck and BBL for those reasons, all right? And that's only one of the reasons. There's many reasons why I don't make that combination. I think really the most important one is patient safety, right? So as you all know, here at Pure Plastic Surgery, we're all about safety. Your safety is our #1 priority. It's what we're known for here in Florida. We're known as the safest clinic in South Florida. And so when you combine a tummy tuck and a BBL, you're gonna be increasing the rates of complication, okay? Complication rates go up when you combine a full BBL with a tummy tuck. And I'm talking about potentially serious complications such as blood clots. Blood clots can start in the leg, called the DVT or deep vein thrombosis, and then they can then travel to the lungs called the PE or pulmonary embolus. Okay, and so when you combine those two surgeries, the risk of blood clots goes significantly higher. Also, the risk of what's called skin necrosis or skin dying. So if you're doing liposuction, especially in that front belly area at the time of the tummy tuck, it's possible that then you're removing too much of the blood supply to the area because you're hitting it twice, right? You're doing the tummy tuck, which means you're undermining and you're lifting everything up and then pulling it down. That's one hit. And then if you do the second hit with liposuction to that same area, then you can lose blood supply to the area and the skin may end up dying, what's called skin necrosis, and that's going to leave a huge, ugly, nasty wound. Okay? So that's why I don't think it's a good idea to combine these procedures. Complication rates are going to go up. Risk of bleeding and needing blood transfusions goes up as well. And risk of infection goes up as well. So I just don't think it's worth it. So if you are truly wanting a full tummy tuck and a full BBL, then I recommend separating out the procedures. Do your tummy tuck first and then come back 3 months later and do your BBL. That's going to be the safest for you. We're going to follow the rules that are given to us by the Department of Health, and you're going to have the absolute best results because you're going to get the best results from that tummy tuck and the best results from that BBL. Nothing gets compromised, okay? But this is totally okay because here, once again, you're not flipping around, right? The patient's not flipping around. Okay, we're using that fat that we're already going to remove with the liposuction to the flanks and the waist. We are keeping to the limit that is given us to the Department of Health, so we are following the rules. And then we're using that fat to accentuate the hips to give you more of that hourglass shape, okay? And we're not increasing risk, we're not increasing complications, and we're not making your recovery tougher because you can be just in the same position that you're going to be after your tummy tuck. You're going to be in that incline position, face up, because that's not going to compromise the hips, right? With the tummy tuck, regardless, you're not going to be laying on your sides, and you certainly, of course, don't need to be laying on your belly because we're not transferring fat to the buttock itself. So it doesn't compromise your positioning after surgery either. So that's why I think it's a great, great, great add-on to your tummy tuck. And guess what? Just so you know, right now, Dr. Vidal, who's been voted best mommy makeover in South Florida, is now offering a fat transfer to the hips at the time of the tummy tuck or mommy makeover. Absolutely free. That's right. No additional cost for that right now for Dr. Vidal if you book in February or March.
If you want to show them here.
You want to show? Yeah, the little
ad?
Yeah,
Yes.
sure. Let's see where we go. Over here, TikTok, over here. There we go. So that's right. Okay, so if you book in February or March with Dr. Vidal, you can get this add-on, which I think is truly great, at no additional cost. Okay? All right. Highly recommend it. What are the pros? The pros are, of course, hourglass shape, right? So if you were to have your tummy tuck, of course, that's going to fix the belly. Okay, but if you have kind of that kind of hip dip area, which kind of sometimes looks like that, maybe a little exaggerated, okay? But the dips here, if you do the tummy tuck alone, it's not going to fix the hip dip. But if you do, of course, the fat transfer to the hips at the time of the tummy tuck, then you're going to get more of that hourglass shape, which is what everybody's looking for, okay? So that is the advantage to doing that at the same time. And also, why throw away the fat? There's really no reason to throw it away. We can use it and make the results even better. Okay? So, having said that, happy to answer all your questions.
I think you should sit, Doc. We have a lot of questions. Yeah, take a seat.
Let's get to it then. Let's get to it. Let's try to see if we can get them all.
Okay, let's start on TikTok. More than 1,800 likes at the moment.
Nice.
So you're on fire.
Yeah, TikTok on fire today.
Yes. ¿Dónde están ubicados? Porque también hablamos español.
Claro que sí. Quiero saber que aquí todo el mundo habla español. Todos los cirujanos. El doctor Wigger un poquito. Pero todo el staff, todo el mundo que trabaja acá en Pure habla español. So we speak English and Spanish. We are fully bilingual. Okay. ¿Dónde estamos ubicados? En Miami, Florida. y la clínica se llama Pure Plastic Surgery.
Okay, a lot of questions about pricing and quotes and consultations. Let's wrap in one thing.
Okay, so there's typically a lot of questions about all that. So what's the easiest way to get the process started is to go to our website. Okay, so you're gonna go to www.pureplasticsurgery.com. Okay, so go to the website there, and there you're gonna hit a form or a button that says, start your journey, and there's also one that says virtual consultation. Okay, if you hit the button, virtual consultation is gonna send you to a questionnaire. You can fill out the questionnaire, send some photos, and that's gonna come here to our patient care coordinators. I'll be able to review all that information and then come back to you with recommendations. And that's the easiest, fastest, most efficient way to get the process started. Okay, but you can also always call us at 305-230-4326. Okay, and that's a good way to get a hold of us as well. And then once that coordinator reaches out to you, she's going to tell you she's going to give you a whole bunch of information, including all the pricing, the quoting, and all that. We have 3 different surgeons here at Pure. The price points are all different as per surgeon. But the one thing again that I want to point out is that right now, if you book a tummy tuck with Dr. Vidal, you're going to get fat transfer to the hips gratis, free, no additional cost. Okay?
And if they book with Dr. Wiggerith,
and if you book with Dr. Wiggerith right now for February and March as well, you get a free add-on. Any add-on that you want, any add-on, completely free. If you have your surgery in February or March.
Okay, say that. Does it make sense to just do a lipo 360?
Yeah, of course. So that is a very common surgery actually. And does it make sense? Of course, it makes sense for the right patient and also for what your goals and expectations are, right? So not all patients want to change their hips. Not all patients have hip dips. Not all patients are, a lot of patients can be happy with kind of the buttock or everything else. So yeah, in that particular case, a lipo 360 is a great solution. And so that's able to, continue to contour the body. And depending on what the look is that you want, what your goals is, sometimes we can add, an athletic look to your lipo 360. For example, what we call a high definition or HD lipo. And we can also do HD lipo to other areas of the body, such as the arms or the legs, the thighs. You can also do, additional liposuction and tightening to the chin as well. Okay, so these are all things that can be done. And if you want to really kind of do a whole body overhaul and really turn that into look into one of those ripped athletic bodies, we also have what's called the total definer package. Where we do a bunch of different combinations to really get you that athletic look. We combine liposculpture 360 high definition, and we also use Vaser, we use body type, we use Morpheus 8, and sometimes fat transfer as well, in order to get you that look that you want.
Mi hija se operó con usted y quedó bella.
Oh, qué excelente, me alegro mucho.
Llamé para mí, pero no operas mamacitas mayores.
Oh, sorry. Bueno, sí, tengo un límite de edad y bueno, también depende del procedimiento, pero en general el límite de edad para mí, para la Lipo 360 o el BBL, es 50 años máximo. Ahora si estamos hablando de un tummy, seno, my makeover, hasta los 55 años se puede operar. Okay. Ahora, mis colegas, como digo, la doctora Vidal y el doctor Wiggerith, tienen otras variables en términos de edad y creo que ellos sí hacen pacientes que son un poco mayores.
Can we sit after a transfer to the hip, or do we have to use those BBL chairs, BBL pillows?
Right, so that's the great thing. So what I'm talking about here is strictly fat transfer to the hips, so sitting is perfectly okay. So you don't have to worry about additional pains of going through in terms of recovery. You don't need a BBL pillow. You can sit how you normally would sit. You can kind of lay face up how you normally would. Of course, you just can't be laying on your sides. But as long as you're sitting, sitting normally, it's not a problem.
Is it possible to have the mom pouch with Lipo 360?
The Mons, yes. Yes, of course. So Lipo 360 involves the entire trunk area. Okay, so what does that mean? That means the entire belly or abdomen, all of the flanks, all the way from the armpit down to the waist area, pretty much the entire back. And in the front, yes, it includes that suprapubic or Mons area as well. That is all part of your standard liposculpture 360. What are additional areas? Let me tell you. Some additional areas are the arms, the thighs, the most common is the inner thigh, and the chin. Those are all additional areas. And then there is one additional area, the axillas as well. So like these areas here in the front is an additional area. And then for some people, not everyone has this, but there are some people that have what's called a buffalo hump, excess fat right just below the neck in that very, very upper back area. If you have a buffalo hump, that's an additional area as well.
Okay, what's the recovery like for 360 and transfer to the hips?
So the recovery for Lipo 360 or for Lipo 360 with fat transfer to hips? Yeah? Or
not? No, the 360 with transfer to the hip. So what's the recovery?
Yeah. So that's essentially a BBL, right? You're doing Lipo 360 fat transfer to the hips. You can do hips or hips and buttock. That's fine. But you're essentially talking about BBL, liposculpture 316 fat transfer to hips or hips and buttock. Recovery, the recovery, first I gotta say that it is a commitment, okay? It is a commitment because there are a lot of things that you have to do in order to help optimize or maximize your results, okay? What am I talking about? Well, you have to commit to massage, okay? Post-lipolymphatic massage is extremely important, and you have to commit to a minimum of 20 massages after surgery, and you're gonna start as soon as the day after surgery, okay? You also have to commit to garments. You have to wear a compression garment the first 6 weeks, night and day, and then an additional 6 weeks for 12 hours a day, all the way up to the 3-month mark, okay? There's a commitment to nutrition. You have to, quote unquote, feed the fat for the first 3 months, which means you have to increase the healthy fats in your diet, such as avocados, eggs, red meat, salmon, and macadamia nuts, and other examples there. Okay, in terms of pain, it is quite intense in the first 48 hours, and then after that, that pain level drops off very, very quickly, okay? But you have to kind of power through the first 48 hours. Now, this is just a very rough overview, but one of the things that I like to say is that if you come and you book a surgery with us here at Pure, that we basically hold your hand every single step of the way, and we give you very specific instructions as to what to expect and what you need to do at each stage that you're in, from pre-op all the way through post-op.
And they can check our YouTube channel.
That's right. That's right. So this live and other interviews and what to expect videos, etc., are all found on our YouTube channel. So you can go to YouTube. So you go to Pure Plastic Surgery on YouTube. Please go there. Look at all those videos. You're going to get a ton. I would say a wealth of information there. Pretty much any question you can think of has been answered in those videos.
Okay, Doc, can the fat be transferred to the breast to give a lift look?
So the fat, okay, let me split up the question. Can fat be transferred to the breast? It can, yes, and some surgeons do that. I am not one of them, but it is possible. Now, and why do I do it? Because of the second part of the question. Can it give you a lifted look? And the answer is no. So fat transfer to the breast will not lift the breast, okay? And it won't even really give you that upper pole fullness that you really want in the way that an implant does. So when you do fat transfer to the breast, yes, it gives you more volume, but it gives you more volume in the same shape that your breast basically is already, okay? So sometimes some people will combine, say, a breast lift with fat transfer to the breast. That may be a combination that you need, okay? But I much more prefer using an implant. An implant really helps reshape the breast, round out the breast, give you that nice upper pole fullness, give you that cleavage. So I really, really recommend the use of an implant with or without a lift, depending on the patient.
Okay, Doug, next question. I found it funny. Look at this. Is the cost dependent on your size, height, For example, a taller person versus a shorter one.
So that's a good question, but no. It would just be way too complex for us to do that, really. And also, not necessarily because you're taller or shorter, does it make the procedure, shorter or longer or more or less complex. There's really a lot of things that go into it. For example, maybe, yeah, you're a short person, but you've had, lipo before. Well, that by itself is going to make your surgery more complex because you've had interventions. Now you have some degree of scar tissue, fibrosis, etc. Or you can be a tall person who is in the perfect BMI, say a BMI of 25, never had surgery ever before, and maybe that's a much easier case, right? So there's too many variables to really try to put that into play when we're talking about a quote or pricing. So it's basically one standard kind of quote or pricing for the specific procedure that you're doing.
YouTube, it's on fire.
On fire today?
Yes, sir.
All right, it's because we're going vertical.
I don't know what to
Yes.
say. What if I already got a tummy tuck and a skinny BBL at your office? Now,
Yeah.
I really want a fat transfer to my hips with
Okay.
a tummy tuck, but at the time, well, it wasn't offered.
Okay, but you're coming back. So I'm not sure if I understand the question, but if you're coming back for your tummy tuck, then yes, we can still do the fat transfer to the hips. That's not a problem. Or if I'm not sure if I understood the question, but if you already had your tummy tuck, yeah, we can still do say a more limited lipo and fat transfer to the hips. But the bottom line is, if you want more fat transfer to the hips, that can certainly be done.
Thank you, Doug. I had a BBL, but I need a second round to the lack of projection.
Okay.
Should I gain weight?
Well, that is quite possible. So that's going to depend a lot on your height, on your current height and weight, and what we call the BMI. But also, just how the way that your body is composed. Because two people may have the same BMI and the way their body looks is completely different, right? So what I would say the best thing to do is to get an evaluation, right? Go to our website, go to that virtual consultation form, send us your info, send us your photo, let me look at all that, and then determine whether I think you need to gain weight for a second round BBL or not.
Question. I remember you said that cool sculpting was bad for lipo because it made the fat like cement.
Yes.
How about is radiofrequency and cavitation after 1 year post lipo and BBL? And she also sent this question as a direct message, and I haven't answered her.
Okay.
I didn't know
Yeah.
that really yet.
So the first part is actually quite true, right? So cool sculpt can cause this paradoxical adipose hyperplasia, okay? Instead of shrinking the fat, it does the opposite. The fat grows, but it grows in a way where it's kind of very fibrotic, kind of very scarred down. And so that actually makes it tougher to do liposuction afterwards. But having said that, it is the only solution to it. That's what we have to do. So what do? We employ the use of the Vaser to help with those patients. Having said that, Vaser, I use that for all of my liposculpture patients now. Anyone who's having liposculpture 360 or BBL, you're going to get the Vaser because I found it extremely useful because I'm able to remove more fat with less bleeding, less inflammation, and better skin retraction. And it especially helps for those patients that have had cool sculpting in the past. Now, if you had lipo in the past and you've had cavitation and radiofrequency, that's actually typically okay. Those are kind of very normal treatments that we use after liposculpture or BBL to help the skin along. And those don't seem to adversely affect the skin or the fat afterwards if you come for round 2. What does affect the round 2 is just how much scarring you just have in general from the first round, and if they use a certain modality that's called smart lipo. Smart lipo actually uses a laser with an L, and I know it's very confusing. It's not the same thing, okay? Laser with an L is not the same as the Vaser with the V, okay? So Vaser with the V is awesome. It's great. I highly recommend it. I use it for all my cases. Laser with an L is not good, okay? It melts the fat, creates really tough scar tissue, The skin, sure, will retract, but a lot of times it retracts in a way that you don't want, and it causes a lot of contour irregularities and fibrotic scar tissue that is impossible to get through in the second round.
Quick question.
Yeah.
Do you do lipo to arms?
Definitely. So it's a great procedure that can be done either on its own or it can be done as an add-on. Most commonly we do it as an add-on, to your BBL, add-on to your Lipo 360, add-on to your tummy tuck or mommy makeover. We can add it on to almost pretty much any procedure. And I do highly recommend it, especially at the time of Lipo 360 or BBL. Because we're able to remove some additional fat from the arms. We can contour the arms a bit as well, and because what happens if you do Lipo 360 or BBL, and then you gain weight in the future, and you didn't do the arms, you're going to disproportionately then gain weight in the arms, and so you're going to end up with these big gorilla arms in a tiny body, and you don't want that. Okay, so I highly recommend it as an add-on to your Lipo 360 or BBL.
Okay, how long do you recommend a faja with a tummy tuck and lipo to the flanks?
So if you do a tummy tuck with the standard lipo that comes with tummy tuck, which is the lipo to the flanks and the waist, initially you're actually going to start with an abdominal binder because I use drains. So I use drains. And so you're going to start off with that binder, which is a white thing that wraps around you. And you're going to use that binder until the drains are removed. Once the drains are removed, then you can switch to your faja. And you're going to start off with that kind of stage 1 faja. And after, once your body and swelling and everything starts to shrink down, you can then switch to a stage 2 faja. But you're going to use it night and day for the first 6 weeks, and then 12 hours a day for an additional 6 weeks up until you get to the 3-month mark. Some patients actually like to use it longer.
1 year post-op.
Yeah.
BBL. I wore my faja and had over 30 massages,
Okay.
but I still end up with fibrosis. Could getting more massages and wearing my faja again help?
So if you're already a year post-op, it's more difficult for these non-invasive modalities to continue to help. Now, they will help in an incremental way, and massages always help. Wearing the faja probably won't necessarily help anymore. Doing some external treatments with, say, for example, cavitation, radiofrequency, or Morpheus 8 could help as well. Okay, but once you get past a year, you also have to consider perhaps going back and doing surgery to try to improve the fibrosis, and we can do that with the use of the Vaser device as well.
Do you do video consultations?
Certainly, yes. So I would say most of our, like 80% of our patients are from out of state. So people come to us from all over the U.S., even as far as Hawaii. So from all over the U.S. and international. We get patients from Canada, we get patients from South America, Europe, the UK is very, very big as well. And we've gotten patients as far as Australia and Ghana and Nigeria as well, okay? So in order to, of course, evaluate all these patients, we have to do virtual consults and video consults. So the virtual consultation is the best way to kind of get started. And there's where you're going to send your questionnaire and your photos for an evaluation. And then once the patient coordinator reaches out to you, if you want to do a video consult, she can help set that up as well.
Doc, this is another question.
Uh-huh.
Says, thank you, Dr. Earle, for taking the time constantly to answer the same questions over and over again. It's clear you care to inform and support future patients.
That's right, that's right. And you know what? It is my pleasure. Let me just say something here, because it's part of a new series I think we're about to kick off. But before I started here at Pure Plastic Surgery, there was no one giving information out. Like, we were one of the first, and not the first, to do these educational lives, okay? And before that, it was just all about like the before and after and this and that, and nobody talked about potential complications. Nobody talked about how to prepare for surgery. Nobody talked about what to expect, how to take care of yourself after surgery. and there was really like minimal education out there. And so I started doing these lives, and then we've been doing it for about 6 years now. And people became really, really interested because they really need to know and find out. And you know why? It's so important, because the educated patient is, number one, a more comfortable and less anxious patient. And number two, they're going to take better care of themselves, which means they're going to have less complications and better results. And that's why it's so important. That's why we do this here every day. And yes, you know, if you've been following me for 6 years, then you know, yes, some of the subjects come up over and over again. Some of the things can be repetitive, but you know, it's not always the same people watching at all times. So I think it is important to go over these very, very important issues, you know, multiple times throughout the years, to make sure that all the information is getting out there for you all. Okay, and I think it's a great place to stop for today. But yeah, if you love the education, please, okay, follow us on YouTube. Go to our YouTube channel, Pure Plastic Surgery. There's a ton, there's 6 years worth of videos there, which will probably answer absolutely any question you could potentially think of. And then make sure to tune in for all of our lives here. So Hump Day with Dr. Alex Earle is on Wednesdays, Tuesday Tips with Dr. Vidal, and Thursday Thoughts with Dr. Wigriff. I mean, we are constantly giving you guys great information. And guess what? We are all double board certified plastic surgeons. Okay? All right, but I look forward to seeing you guys next Wednesday on Hump Day with Dr. Alex Earle. Take care, everybody. Ciao.
Great like that. Yep.